Well, I think that there is enormous potential for their use, and actually the areas that I find actually most exciting are the areas where we're beginning to find out a little bit more about them. We've been conducting a longitudinal study where particularly what we've been looking at is the potential for the biomarkers in terms of prediction of outcome. So what might broadly be termed risk stratification. If you had a population of dogs with valvular heart disease and you measured a natriuretic peptide concentration, could we pick out those that are at greatest risk of going on to have some detrimental outcome? Now, the outcome that we've been looking at is kind of the worst of all, which is death. And what we've found is that there is a fairly a very strong relationship, very significant relationship between natriuretic peptide concentration and risk of death in the succeeding period of time, sort of 12 months, 18 months. To the extent that we could take a concentration and say above this value we have a much higher risk population, and below this value we have a lower risk population. Now, I think that's a very valuable potential use, because if you look at the sort of quandary that practitioners frequently have, it's, I have this dog in my surgery, it has a murmur, what does that mean? How bad is this disease, and is this dog going to go on to have a problem in the near future? If we have a marker that could potentially answer that question, and perhaps even one that we could evaluate at fixed intervals, say every 6 to 12 months, I think it would be of great value for monitoring the disease process and prognostication. So that, I think, we already have some evidence to suggest the value of natriuretic peptides in that area. Interestingly, troponins, although I sort of dismissed them somewhat as being a diagnostic marker, they may well also have some prognostic potential, because in the late stages of the disease process where the heart muscle is remodeling, there is a loss of functional heart muscle as the disease goes on, and it may be that that rate of loss is reflected by an elevation in troponin concentration. So troponin may also have a role to play for risk stratification and prognosis. Now, an area where we really largely have not explored it at all in the veterinary field, but where there's enormous promise from the human field, is actually to use biomarkers for the titration of therapy. Maybe not necessarily to indicate when therapy needs to be initiated, but from the point of view that if you have a patient who is in heart failure, you may have a target concentration of, for instance, N-terminal pro-BNP, down to which you want the concentration to go, and you will increase the intensity of your therapy in an effort to reduce it. Now, that would be what we would call BNP or biomarker-guided therapy. And in several human studies now, it's been shown that BNP or biomarker-guided therapy results in a better outcome, actually a reduction in mortality compared to best clinical practice. I think there's a huge area there which is as yet unexplored, but could revolutionize the way we manage heart failure over the next few years.